Hello, it's Dr. Shelly, and I have a treat for you. And you will love this video because it's graduation time. It's June, it's 2024. We are trying to get you a license, and this will do it. Now, we don't want to get you a license after failing. We want you to pass this test on the first try. So the name of this video is How to Pass the NGN NCLEX on the First Try. So here we go. We're gonna jump right in because some of you guys are about to mess up some stuff. Here it is, the number one mistake new grads make. You need to plan to take your test within 12 weeks of graduation. But that whole graduation date is kind of goofy. So let me say it to you this way. Plan to take your NCLEX exam within 12 weeks of the last day of instruction, which for most of you was your final exam. Look at the date that you took that test and plan 12 weeks out to be ready. And then let's get a schedule and do it. Now, don't worry. I have a 12-week plan for you to do this NGN NCLEX preparation. So that's already in my HETV playlist. Just look for 12-week plan. You'll be fine. Now, that's big because when I look at why students fail, the number one reason was they graduated in June. They didn't take their test till October or September, something crazy. September is the deadline, okay? If you graduated in June, count down the 90 days. September is it. Why is you all up in December and January with this mess? Take it right away. And really don't stop learning until the day of the test, okay? Number two, you cannot avoid this. This would be probably one of the most important tips on my board. You need to buy NGN NCLEX type software. I prefer UWorld. Many of you have bought Archer. When I talk to students who have failed, it's usually because Archer was too easy and Archer told them to take their test, and lo and behold, they actually failed. In fact, I have a young lady, Cassandra, who registered and took our 3-day boot camp here in Cleveland, Ohio. She came all the way from Utah, Utah, to take my class. And when she came in, I'd already done an assessment on her that told me that she did Archer, and on Archer she had 70%, which told her, go, do your thing, take your test. Well, she failed in 85 questions because, I'm sorry, it's too easy. So I need you to invest in your education. Just bite the bullet now. Ask for your graduation present to be UWorld subscription. They don't pay me. I don't get kickbacks. I'm not that girl. I got enough money, believe it or not. So let me just tell you how serious UWorld is, because maybe you don't understand why I like it so much. So this is the UWorld app, right? And on the UWorld app, they have, and I don't know if you can see it if I'm close enough, but they have these test 1, test 2, test 2, test 3, and then they have the question bank. The actual NGN RN test, whatever numbers after it, because I used the first one. The NGN test, that is this. When you get your UWorld and you buy this, I would buy the 90 days because that's what most people need, or 60 if you're really smart in school. It didn't take a whole lot for you to be ready. You went to a really good school, just buy 60 days and keep it moving. But when you do it, immediately, as soon as you have about 4 to 5 hours to do it, I need you to stop and take the assessment test immediately after you graduate. Then take another one, because you see that UWorld gives you 2 assessment tests. Take the next one 1 week before your NCLEX. I'll go over that again, but I was just showing you what that is. That's right in here. And for every single UWorld subscription, you're gonna get these tests, these practice tests that you need, okay? They're at an assessment, but I call it a pre-assessment. That's not the only reason I like UWorld. I like UWorld because they also have kick-ass videos. The videos are boring. We all know that some of these videos are just sleep-inducing. We know that. Well, you know, if you want excitement and dancing and having fun and you know, me cussing you out, you can always go to my HETV and pull up those videos. But if you just want it quick and easy and just fast and to the point, boom, there's your UWorld videos. It got, I think, over 300 videos at least. And it is on the content that you have to know. But my other reason for liking UWorld is they update the material constantly. One of the problems with new nurses is you go on YouTube, and YouTube is like this world of videos on everything. That's great, and I'm excited for you, but your videos that you watch cannot be older than a year or two. Some videos are like 8 years old. You're not gonna get anything from that. Stop watching old videos. Look for new, look for under 2 years. The test is going to ask you the most current information. Okay. Only do mini quizzes. Miniature, mini, small, tiny. Only do miniature quizzes, no more than 5 to 25 questions in the quiz itself, but do a lot of them all day, right? So you're doing them when you're at your child's school waiting on them to come out of the building. You're doing them when you're at the bank and the bank line is long. You're doing them when you're in the pediatrician's office waiting on them to call Johnny. You're doing those NCLEX questions when you're in Walmart and the line is down the street and through another city. You're in line for Popeye's chicken and you know that's a 2-hour wait. You're doing your questions. Miniature questions, like miniature. You know what I do? 5 at a time. You need to really understand this information in the question, and you need to review the rationales, and to do that, keep it small. Now you're supposed to do them all day. And get this, tip number 4, you're supposed to study one subject at a time. I teach you to start with psych because I find that students know psych the least. And so study psych first, and then get on top of that. You do need a 5-subject notebook, probably about 3 of them if you just want to go the cheap way. I obviously have packets if you need them, self-study packets, but you don't necessarily need that. But if you wanted to do this correctly, you're going to do one subject at a time, and you're going to fill out in those 5-subject notebooks, each subject at the top, and put little notes in there that maybe you didn't know stuff about. I will say with psych, like personality disorders are a big one, right? So that's how you do it. And then tip number 5, when you master each subject, look at this. When you master each subject by doing your miniature quizzes, and you're getting 75 to 85% on your miniature quizzes, then you need to do 85 questions in that subject. So you've been doing quizzes all day, quizzes all week, quizzes all 2 weeks if it takes that long. Usually it doesn't. But if you've been doing quizzes all day, little 5 questions here, 5 questions there, 5 questions there, 10 questions here, 13 there, whatever. If you do these all the time and you're starting to get 75s and 85%, then switch it up and go to 85 total. Get that little subject off your checklist. Move on to the next one, which happens to be renal. If you don't know what order to do the subjects in, everything I'm saying right now is in my very famous Oh My God packet. And if you just turn to page 23, some of you already have it, which is why I'm mentioning it. But if you turn to page 23, there is the list of subjects, one by one, that you need to start with. And that really is the best way to go. So that's that. Now, let's go over to the other side of the board. Here, I want you to be selfish. Too many of you are trying to pass an NCLEX, cook mama dinner every single week, even though you got brothers and sisters, take Bebe, Shay Shay, and Bam Bam to 3 and 4 different events a week for after school, like you're the taxi mom. You're trying to cook the chicken at the church and have a sale at the church for donuts every Sunday. And then you're on some ministry or 2, and you're doing all this crazy on steroids. Plus you got a husband and a flavor of the month, which is the first problem. Now, so you need to stop. It's not about the kids. It's not about your family. It ain't even about the church, because God will love you regardless. You don't need a building, you need him. And it ain't about social media. So if you on Instagram, TikTok, Facebook, all of them, we know what y'all doing. Get the fuck off. You ain't got time for that shit. No, get off. Okay, fine, don't get off, but save it for Sundays only. Have your one day of, like, you know, feasting on your social media accounts, okay? Because that will tie up your ass for God knows how many minutes. On average, it's 45 minutes, 20 minutes to 45 minutes at a time that you done got stuck up in this social media and you're not doing what you're supposed to do. And I know it because I've done it. Okay, all right, keeping it real. Now, let's talk about number 7 again, because sometimes y'all don't listen. Number 7 is take a pre-assessment immediately after graduation. Then 1 week before your NCLEX, take the assessment. And this is called the NCLEX RN Test 1. And that's on UWorld. And here's what you got to listen to me. Please listen, please. This is what I do. I've done it for years. Everybody always passes. This is how I do it, y'all. This is what you do. That very first I call it a pre-assessment. It's not called pre-assessment in UWorld. It's just an assessment. I call it a pre-assessment because you're trying to figure out, where am I? Let's say you do that pre-assessment, you just graduated from school and you get 50s, 40s, maybe 60s. Yeah, plan on studying a little longer than most people. But if you take that pre-assessment and you just graduated and you get 65 and up, you qualify for that 12-week kind of guideline. And that's LPN and RN. Do not buy LPN UWorld, buy RN only. Now, if right before your test, and I do mean 1 week out, hear me clearly, 1 week before your test, you do another assessment. If that assessment is not in the 80s or high 70s, sit your behind down and reschedule that test for 2 weeks or 4 weeks or whatever. Remember, you can reschedule this test for however much time you want. You don't have a limit on how many times you can reschedule. There's nothing wrong with rescheduling your test and admitting, I'm not quite ready, because 60s ain't gonna get it at all. There's another problem as well that I always like to tell you guys about. Sometimes some of you want to go through this whole thing preparing for NCLEX like it's a microwave, when it's really more of a crock pot. If you failed a couple times before, or you went to a really bad school, and it bothers me that you don't know what the definition of bad school is. It means that your school has a shitty NCLEX passage rate. What should it have? 75%, 85% and higher. So if your school does not have that kind of passage rate, they never really taught you what you needed to know, as evidenced by their passage rate. So you might need a little bit longer. If you're English second language, you also might need a little bit longer. There should be no shame in your game. It is what it is. You want to pass it on the first try, so give yourself every benefit of the doubt. And remember this, if you only needed 2 weeks to pass your NCLEX, then why does every state in this country give you 6 months to a year, except the asshole states, which only give you 3 months? Why did they give you an authorization to test, the ATT? It does not expire for 6 months to a year in most of our states, except for a couple of really stupid states, Florida, that gives you only 3 months. Ask yourself that. Why'd they give you all that time to study? All right, now, this is not from me. This is from thousands of students, this next advice. I don't know anything about it. I'm telling you anecdotal evidence from all the students that keep coming up in here telling me they used it. And I want you to feel like you have a tool. We know that test anxiety exists. So, ashwagandha, under the brand name of Goli on Amazon, the students use this and they tell me it is excellent for test anxiety. Now, there's other things you can also take. There's actual prescriptions you can actually ask for. Don't forget the beta blocker propranolol is actually approved for test anxiety. But if your blood pressure is already low or you're on the tiny side, well, remember what beta blockers do. They cause your blood pressure to drop. So, you know, there's lots of tools, but if you have test anxiety, again, that ashwagandha is, from what I'm hearing, that's the shit, man. So you let me know if that works for you, because I really do want to know. All right, now, are you ready? We're almost done. Study management of care, reduction of risk, and basic care and comfort. Now, on HETV, we have everything organized by playlist. So we have these actual playlists. Management of care is a whole bunch of videos in a playlist. Reduction of risk, which is really procedures, whole lot of videos in the playlist. Basic care and comfort, one big video, but it's comprehensive. It's everything you need. Why? Well, management of care is up to 22% of your test. Your reduction of risk and basic care and comfort are the #1 areas of failure, and they're tied. Like sometimes it's reduction of risk, sometimes it's basic care and comfort. They're tied for the #1 areas of failure. So if I tell you right now what you got to focus on, maybe you'll do it and not fail, right? Because those are #1 areas of failure. Now, don't worry. I also have the same thing you need as well in resources. And you might want the Oh My God packet because it has everything I'm telling you now, plus it has basic care and comfort. A lot of basic care and comfort is in your procedures or reduction of risk packet. This has your basic care and comfort, all your procedures. It has so much that you need that you don't want to ever like sleep on because it's just such a high failure area. And then of course your management of care. And I'm not going to go into great detail about these because everybody knows about the pink packets. But then the last little tip has to do with pharmacology. And even though everybody has pharmacology, this is really the most important one of all. So, and by the way, these are like my medication packets and my Oh My God packet, which is the study guide for all of NGN NCLEX. These are updated. Like I just updated the Oh My God packet this month. And then for the meds this year, you're getting all the latest meds. And I do throw in the most common meds for the test if you want. You do have to, you know, think about that. Now, so last thing, number 10, make medication flashcards. When you buy flashcards and you make them, look at this one. I prefer the colored flashcards with lines on them. I also want you to know that there are 2 things you can learn with flashcards. One is medications. The other one is infectious diseases. When you make your flashcards, you put categories, not individual meds, on the front, and then you flip it over and you put about 6 things on the back, like what does it treat, what should the nurse be doing, who you shouldn't give it to, how does it work, maybe some names of some common drugs that fit under that category. For your infectious diseases, you need the type of precautions, the PPE required. You want to make sure that you understand what the complications are. What does this look like? What is it caused by? What's the treatment? All that good stuff. So no more than 6 items should be on the cards. That's a lot, but that's what we find is pretty common. And then something very simple on the front for medications and infectious diseases. And don't forget, I have a pink packet in infectious diseases showing you which infectious diseases to make the flashcards from. And of course, my medication categories has which categories to make the flashcard from. Now, for a limited time only, and you guys know this is a huge deal, we usually do the 8 for 88, but we're gonna do the 8 for 88 at a 7 for 77 price, which you know is $77. So instead of 8 for 88, we'll do 8 for 77, and we'll throw in the top meds for 2024. All you have to do is test. Are you ready? Yeah, let's do it over here. Top meds you have to text top meds to 216-410-0936, and you can get 8 packets plus a list of all the top meds that are on the exams for 2024. Top meds, that's what we do. Deuces, I hope you like this video.